That was good. But can you imagine drinking this same bottle of Coke and you can't taste anything? It would be worse than, I don't know what to say. I can't imagine not tasting my Coke. Hi, my name is Dr. Madase. I'm an ENT surgeon, and today I'm going to talk to you about loss of sense of taste. As I said, can you imagine your favorite food, your favorite drink, having them and you can't taste them? How miserable life would be. And it's quite a common problem that people have, especially after COVID-19. Loss of taste and loss of sense of smell were one of the common symptoms of COVID-19. And you know that this same thing is called AGUESIA. Can you imagine the long terminology or the strange terminologies? AGUESIA, loss of sense of taste. There are other things that can cause this. Injuries to the tongue, injuries to the mouth, things like burns if you take something too hot, or chemical burns if you, by mistake, drink the wrong thing that is acidic or whatever. It can cause you to lose your sense of taste. There are other things, some infections, especially viral infections, which can attack the nerves and the nerve endings of the tongue, could give rise to loss of sense of taste. They also have other infections, which are a bit more rare, fortunately. And then we have other things such as thyroid diseases, especially hypothyroidism, when your thyroid levels are a bit low or very low, not just a bit, very low. It can also give rise to a loss of sense of taste and smell sometimes. Then we have autoimmune disorders, and this is a wide range of diseases. We have things like lupus, we have things like multiple sclerosis, any disease in which you have the body attacking its own tissues. That's what autoimmune diseases actually are, that the body is attacking its own tissues. They can give rise to loss of sense of taste. And then we have iatrogenic, another strange word, but it just means caused by a doctor. Maybe you're having a surgery, maybe you're having dental work, and the nerve to the tongue, the nerve that causes you to taste things is damaged by the doctor, by the dentist. It's called an iatrogenic cause, and it's not always uncommon. And then we have drugs. There are a whole range of drugs that, if you have to take them regularly, can give rise to loss of sense of taste. So if you start taking a new drug and you notice you cannot taste things, so if you lose your sense of taste, don't sit at home. Try and see an ENT surgeon. Let them help you figure out what it is and what caused it, and then help you treat it.